We are back. I promise that your teeth will look beautiful, but we have to have a guy help us. Dr. Jason Campbell, nice to have you on with us.
Sandy, I appreciate it. It's good to be here this morning.
Well, DDS, and you have Advanced Prosthetics Institute. I'm sorry, but prosthetics, I always think of arms and legs and, you know, feet and stuff, like not real ones, but this has to do with teeth too.
It does, and most people, that's what they think about when they're thinking about prosthetics, but, you know, anything that we're replacing in the body that's artificial, including fillings and more complex things like crowns, bridges, teeth.
Nice. See? Yes. And I tell you, maybe there wasn't as much attention to teeth in decades past, I don't know, but we really are interested in keeping our teeth healthy and having them look good, and we bleach our teeth for heaven's sake.
Yeah.
I don't think, last generation bleached their teeth. I can't get my mom to get into the whole thing. It's like, Mom, it's easy. No. But nevertheless, now first of all, I want to tell people you are giving a presentation on keeping your teeth healthy.
How to maintain healthy teeth. The biggest part of it is just education. There's a lot of information out there and knowing what to do when and how to do it right. For the most part, people do well, but there are issues out there that are more complex. People who struggle with complex dental issues or chronic problems over time. And that's really what our seminar is about, is to help avoid those problems later in life. And working with the Senior Connection, totally excited. Debbie Stewart's amazing.
She is.
Runs a great program.
And this is noon at Los Fuentes Retirement.
It is, yeah.
Community on when? Wednesday the 20th. So,
yes,
yeah.
From noon to 1.
Good. All right. So, wow, a very important thing. Because, I read, I think this is correct, that your teeth and the enamel are the teeth are the only thing in the body that doesn't repair itself.
Doesn't repair itself.
Wow, you lose them, they're gone. They get bad, that's it.
We've made a lot of breaks through dentistry, giving teeth back, having that foundational support. Implants have come a long way. Just being able to restore people back to normal, healthy function, beautiful smiles. That's kind of what we're about.
That has a little bit to do with self-confidence, doesn't it? If you're missing teeth, if your teeth look bad, people like this kind of, it's a big part of who we are.
It's probably the funnest part of what I do, when you take somebody who's struggled with that, the emotional side of it, and give them back something that they can walk out and be confident with. It's amazing.
You see that kind of a thing. Well, tell me the focus of Advanced Prosthetics Institute, if you would, Dr. Campbell.
I will. So the Institute was started because my practice focuses on treating complex dental issues, people who've had long-term chronic dental problems. Sometimes there's medical conditions that add to the demise of teeth. And so our practice is focused on that for a long time.
Which is interesting. Yeah, tell me some of the things that affect your teeth that really shouldn't have anything to do with them, but they do.
Yeah, the bottom line is tooth decay, gum disease, those are primary causes for tooth loss. But there are some other categories that we don't always think about. If you think about the forces on teeth or the biomechanics of your teeth, we don't always consider that as a promoter of tooth loss. Sometimes people have pathologic issues, clenching, grinding, or they have medical conditions, digestive issues that create a lot of acid in the mouth.
Isn't that amazing?
And despite their best efforts of brushing, flossing, they still have a lot of dental issues, and they just aren't aware of where they're coming from.
Dang. So now the dental prosthetics, you kind of talked about those. But surgical, do they all have to have surgery usually when you have to add like a tooth or
not always. It depends. There's solutions for everybody. It depends on a patient's preferences. Sometimes people want permanent solutions, not removable solutions. And in order to do a permanent solution, we have to have roots or some other thing to create a foundation, and so dental implants are a form of surgery. And then making those implants happen can become, involved, but we've come such a long way in dental surgery that a lot of times those procedures are mostly painless, and our patients do really well with them. Yeah. But it comes down to foundation. You got to have something to attach the teeth to in order to make it work.
Oh, I know, and it's kind of scary. Like, my dad's like in a cup in the bathroom, at night, some of his teeth, and you're like, ah!
Yeah, it's a horrifying endeavor. Some people, they just don't want things that'll come
And so those are temporary. Yeah. You want some. Why did you decide to specialize in these prosthetics?
I'm not a specialist. I'm a general practitioner that focuses his practice in surgery and prosthetic reconstruction. But You know, I've got a problem in my own family with genetic conditions for missing teeth, and my own children will struggle with this. In fact, I just did a major surgery on my daughter, trying to get her ready. She's working with her orthodontist. By the way, in Prescott, we're lucky we've got some awesome specialists, dental specialists. I think we're fortunate that way.
Yes, Prescott's pretty good with all of this stuff, I tell you. So, and you like to educate. I mean, we talked about the seminar, but this is kind of something you do in your practice that maybe dentists haven't always really done.
Yeah, you know, I think just linking the proper things together, there's a real gap between communication between the dental profession and the medical profession. But sometimes medical conditions are the cause of dental issues, and sometimes vice versa. And so we've worked really hard to try to close those gaps with our medical community. We're working closer with our dental specialists to try to close those gaps as well. And just educating dentists in that process. It's not an easy thing to do because treating chronic pain or chronic problems, it's much more involved, it's much more time consuming. It requires, you know, more diagnostic time. And not every business model is set up that way. And so we've really focused to try to build systems in a practice that help people with their long-term chronic problems and yet get them back on track.
We totally appreciate it because, you know, smiles they're just important. I mean, your teeth, besides eating is, you know, you want to feel comfortable eating. Again, more education, Senior Connection Speakers Bureau, August 20th, noon to 1, Las Fuentes Connection. You can hear more from Dr. Jason Campbell.
Awesome.
Thanks for joining us.
Thank you, Sandy. Appreciate it.
Don't go away. We will be right back. We're going to talk about kids going on hikes. Where can you take your kids hiking? We'll tell you all about that.